Hi, I'm Dr. Naimisha Rao. I'm the consultant pulmonologist at Wellness Hospitals. After successfully running our hospital at 2 branches, we have started a 3rd branch at Ameerpet. Here we treat all the diseases that affect the lungs like COPD, asthma, bronchiectasis, pleural effusions, tuberculosis, lung abscesses and many more. We also diagnose lung cancer. And we also treat life-threatening conditions like pulmonary thromboembolism, pulmonary edema, massive hemoptysis, traumatic hemothorax, pneumothorax and severe pneumonias. Coming to pneumonias, they can be bacterial, fungal or viral. In viral pneumonias, we also treat swine flu and we have treated hundreds of COVID cases with very good recovery rates. And here we have a full-fledged ICU setup to treat critically ill patients with respiratory failure and who are hemodynamically unstable. And we also have a very good team of all the specialist doctors to treat the patients who come with multiple comorbidities. And we also have facilities for interventional pulmonology. That means we do interventions like tube thoracostomy, diagnostic bronchoscopy where we insert the scope through our nose or mouth into the respiratory tract and visualize and look for any abnormality and take the samples and biopsy specimens to diagnose certain diseases. And we also do medical thoracoscopy and VATS where we make a port or hole in the chest wall and drain the pleural fluid from the pleural space, take pleural biopsies, do pleurodesis, pleurectomy and so on. And we also have bronchial artery embolization facility for massive hemoptysis patients. That means in patients who cough out large amounts of blood, we identify the artery which is causing the bleed and we embolize it to reduce further bleeding. It is important to know when to consult a lung specialist or a pulmonologist. The symptoms that suggest that your respiratory system is affected are cough and chest pain, difficulty in breathing, wheeze. That means some patients with airway diseases produces noise when they breathe out. And other symptoms like increased sputum production and sputum color which changes to yellow or brown or black and coughing out blood and unexplained loss of weight and appetite and enlarged lymph nodes in the neck. You notice it as some swellings or lumps in the neck and recurrent cold episodes and recurrent sneezings. There is another entity which is related to the sleep. We call it as sleep-related respiratory disorders and the most common of which is sleep apnea. Most of the patients with sleep apnea present with frequent arousals from the sleep during night, excessive daytime sleepiness and early morning fatigue, early morning headache and excessive snoring. So patients with all these symptoms must be properly evaluated with all the necessary investigations which we have in our hospital before we initiate the treatment, because most of the lung diseases present with same symptoms but the approach and treatment to the disease is different. Unfortunately, apart from the infections and pneumonias, most of the lung diseases persist throughout the life. But proper treatment can control the disease progression. So, early recognition of the symptoms by the patient and early initiation of the treatment is always recommended. Otherwise, the patients may land up with respiratory failure and may develop cardiovascular complications. Apart from the treatment, we also educate the patient and the patient's family members regarding the condition or the disease he is suffering from. And we also explain them about the care that needs to be taken post hospitalization. We also advise chest exercises and the breathing exercises and proper vaccinations that need to be taken. We also check after the proper technique of the inhaler devices if needed. Thank you.